Welcome to Clyde Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. John Patti, the Medical Director of Palliative Care at the Buffalo General Medical Center and Millard Fillmore Suburban Hospital. Today, we'll be discussing the importance of palliative care. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Patti. Thanks for joining us.
Thank you.
Can you tell us a little bit about your background and how you became involved in palliative care?
Well, I began my training with internal medicine and pediatrics, and then I worked in primary care for 10 years. I eventually moved my practice into the hospital, and I realized pretty quickly that much of my day was dedicated to seeing sick patients and having discussions around symptom management, goals of care, quality of life issues. I wanted to learn more about taking care of the sickest patients.
Right.
So I decided to work at Center for Hospice and Palliative Care of Buffalo, and I ended up getting board certification in palliative care and hospice.
So that need that seemed to started to grow in maybe it was the early 2000s. It seems like your group has filled that void of the in-hospital work and taking care of those palliative patients. Did you guys see that there was a growing need for this?
I did, and you know, like I said, like it seemed like much of our day was centered around a lot of these discussions, and you know, it's hard when you have patients to see, you know, a list of patients to see throughout the day to kind of spend the amount of time that's necessary to have these discussions.
Sure.
So that's where the specialty comes in, is you're allowed to spend whatever time you need to have these discussions with these families and patients, because they're important discussions.
Sure. So the discussions can have both a hospice discussion as well as palliative care. We're here to talk about palliative care today, but if you can clear up the misconceptions or maybe explain the difference between hospice and palliative care.
Well, hospice care is really focused on patients. Well, first of all, they both provide comfort. Okay. That's the number one goal.
Okay.
Hospice is really reserved for patients that it's apparent that they're not going to survive.
Sure.
And the treatment has stopped. Palliative care really starts at the time of diagnosis, and it can go on with treatment and right on to the end of life if necessary. The definition of palliative care is, you know, the basic definition is taking care of patients with serious illness.
Okay.
And that's really it. But it's focused more on taking care of not only physical symptoms, but the emotional, social, and spiritual aspects of their illness.
So when you see patients that need palliative care, give me a range of the types of conditions they may have, or illnesses, or maybe surgeries that they've had.
Mm-hmm. So most of the patients that we see have advanced disease. You know, a fair number of them have cancer diagnoses, people with advanced dementia, and we see a lot of patients with advanced severe heart and lung disease.
Sure.
Those are the most common.
Palliative care obviously is growing within the hospital segment. Are patients sicker these days than, say, maybe 5-10 years ago when you guys first started looking into this as kind of a niche? Are the patients that you're seeing, whether it's at Millard Suburban or Buffalo General, are they sicker?
I wouldn't say they're sicker. I mean, people are definitely living longer. When I look back to my residency, it was very unusual to have a patient who was 90 years old.
Sure.
And now you would almost argue that half of our list are patients that are 90 years old or older.
Right.
So, you know, with advanced age comes more illness. And,
right.
So that's probably true.
Palliative care seems to be growing within the hospital industry in particular, but why is it an important part of the clinical care process, whether it's for the patient, whether it's for the family, for the hospital? Why is the comfort side of the care process so important these days?
I think people are more aware of quality of life now versus quantity of life.
Sure.
And I think that these discussions started outside the hospital more than they ever have. Mm-hmm. And families want to have these discussions. They recognize that people can't live forever, and they recognize when people are suffering, and they want to focus more on quality. And part of what we do is navigating goals of care with families and having discussions about advanced directives and what we can do to maximize quality versus quantity of life.
So when you talk about having those conversations with families or patients, who has choice in that? Or are you offering them those choices, or are patients and their families, are they educated consumers, or is it kind of a two-way conversation?
Well, there's something called the Palliative Care Information Act that passed in 2011 that states that everyone has a right basically to palliative care with serious illness. So what we find is that most of the referrals for consultation come from primary physicians, whether that's in outpatient setting or inpatient setting. But really, we get referrals from everywhere, including family members, caregivers, and patients themselves.
Sure. So you talked about that act that was passed in 2011. Has that helped legitimize the palliative care industry in terms of, obviously CMS and Medicare, they're backing it up. Has that helped legitimize that and make this an important part of the clinical care process?
Yeah, I think it really has, because they've started to promote it more, like I said, in the outpatient setting, as well. And what they've done is by having this Information Act in place, it's kind of prompted insurance carriers and Medicare to offer reimbursement for providers to have these discussions, because they are time consuming and important. So they're recognizing they're important. They're reimbursing people for having these discussions and spending the time that's necessary to kind of figure out what the patients and families want as far as what's best for them.
So we talked about palliative care in the hospital. Is something that you can have at home as well? I know you talked about outpatient, but can you have palliative care at home as well?
You can get palliative care in any setting. Of course, in the hospital, at all the hospitals in Kaleida, we offer it. But in the outpatient setting as well, a lot of oncology clinics have palliative care clinics in conjunction with them. Right. Every nursing facility and assisted living facility across Western New York has a form of palliative care available now. Okay.
So if someone is watching this, or someone has a chronic medical condition, they have questions about palliative care, or they think someone in their family could benefit from this type of treatment, what should they do to find out more information?
I think there's the two best ways would be, number one, always call your primary physician and ask them for a referral. And secondly, you can always call the Centers for Hospice and Palliative Care of Buffalo, and they have services available both inpatient and outpatient.
Great. Dr. Patty, thanks for joining us today. We appreciate your time on this important topic.
Thank you.
Great, thanks. I'm Mike Hughes. We'll see you next time on Medically Speaking.